Hi, Shawn. How are you?
I'm good. How are you?
I'm fine too, Shawn. Thank you for giving me this opportunity to interview you. So, friends, let me introduce more and give the introduction about Shawn a little more here. So, Shawn is a board-certified hypnotist, a hypnofertility practitioner, and a childbirth educator with over 35 years experience. She is the staff hypnotist at the Alive Holistic Health in Toronto, a clinic that offers traditional Chinese medicine, massage, and naturopathic care. Shawn created the Childbirth Joy Prenatal Hypnosis series in 1999. He specializes in childbirth preparation, fertility issues, pain management, but also helps people with habit change, sleep issues, and other issues. Shawn was a registered midwife in Toronto before and after midwifery legislation was passed in 1994. She attended births in home, hospital, and birth center settings. She co-founded Midwife Alliance in Southwest Toronto and had hospital privileges at St. Joseph's Health Center. She no longer practices as a midwife. Shawn is the mother of two, both born at home. She has a liberal arts BA from the University of Toronto and is a published author in the Bearing Witness Childbirth Stories Told by Dallas series. Shawn is passionate about providing research based excellence for the field of hypnosis preparation for birth. She can be reached at ShawnGallagher.com. So here is Shawn for us, friends. Let us know more about her from her own words. So, Shawn, could you please share what is this evidence-based birth all about?
Well, I created a document to try and pull together some of the data because as I was going over it, I realized quite a lot of detail that I wanted to be able to remember, and I didn't want people to get sort of overwhelmed with. So this
Okay,
is just a brief dive into this. There's a lot more detail that we can provide.
okay. So,
And so as we go to the next slide, we've got evidence-based medicine and evidence-based birth, and I'm sure there's like other areas of medicine that focus on the evidence. And what a lot of people don't know is that it started quite late in many respects. It was 1990 that things started to get rolling in Hamilton and Ontario. So Hamilton is about an hour west of Toronto. And David Sackett was an American physician who moved to Toronto, or moved to Ontario, and worked at McMaster University. And he and a few others created this idea of evidence-based medicine because what they found was doctors were practicing based on their opinion, and their opinion could vary widely from setting to setting, based on their practice, based on their experience, and they really weren't following the research. And so even though doctors today are trained in evidence-based medicine, it's hard for them to follow the research because there's so much coming out in so many different areas. But really, if you have a physician who did medical training prior to 1990, they weren't trained in evidence-based medicine. And so, as we'll see a little bit later, there's a lot that's happened in medicine, especially in obstetrics and gynecology, that's just really bad medicine, but it just kept being replicated over and over and over again. So I wanted to just honor our American Canadian leader in the field, David Sackett. And I love this quote by him because this idea that when you graduate from medical school, you know everything, but that within 5 years of graduation, the information's either wrong or is, being replaced by something else. And so keeping on top of things in medicine is really a full-time job, and medicine in itself is a full-time job. So how doctors do it, I'm not really sure, but
That's amazing. It really makes sense to have the evidence-based medicine studies, Sean.
yeah, yeah.
Okay, thank you. And now here is my next question to you. What is the hypnosis role in helping women in the delivery process, Sean?
Well, we can get to that in a little bit. There's a
Okay.
couple of other pieces here. So I just wanted, because not many people know this. So when they
Okay.
think of evidence-based medicine, they think of, oh, it's just that research, just the evidence.
Okay.
We have research that shows that one particular drug is helpful overall, but given a person's particular medical condition and their preferences and their values. So the preferences and values of the patient or the client are as important as the expertise of the healthcare provider and the evidence. So one way to think of it is a three-legged stool.
Mhm.
And if we say it's only about the research and only about what the doctor or whoever says, then you're leaving out a really important leg, which is what the individual wants or doesn't want. And that's as valuable in that it gets lost a lot, it gets forgotten. And certainly in the world of obstetrics and gynecology, and as we know as hypnotists, we're very focused on attending to what our clients want and asking them, well, because if a client comes to me and says, I want to quit smoking, I'm like, okay, well, how do you want to do this? What's your quit date? I'm very focused on what the client's needs are. And even if the research may say to do X or Y, but not Z, but it seems apparent that doing Z is really going to help this person, then we'll go with that, right?
Yes.
So
True.
as we go to the next slide. So just to really briefly, some of the things that have happened in this is only tip of the iceberg, but this is more obstetrics and gynecology. So thalidomide, we know, caused a lot of problems with the babies when they were born. So depending on when that drug was taken in pregnancy, some babies just didn't have limbs when they were born. They're quite serious birth defects. And that was back in the day where they were not doing randomized controlled trials. And there was a belief that the placenta was a good filter. So the placenta will stop anything bad. And when the whole thalidomide disaster happened, then they realized, oh my goodness, that's not true. Some of the other tests, like testing an estrogen to see how well the baby is doing, prenatal stress tests, like none of these today are valid in terms of good medicine. They're all bad medicine, but they were done a lot. Diethylstilbestrol is an interesting one because that's a very potent estrogen that was given. They thought it might help with preventing miscarriage. They found out it didn't help. Of course, they didn't do the proper research, I'm guessing. But when the children were born, they didn't look like the thalidomide children. So they just thought, oh, okay, well, these kids are fine. They look normal. Everything's okay. And it wasn't until they hit their teenage years where they started developing very rare reproductive cancers that they thought, well, that's odd. And it took a very long time, but they finally started to realize that diethylstilbestrol, DES, is affects the child, but doesn't show up at birth. It can show up later. So our understanding of how babies are affected by say medications in pregnancy changed with DES. The very sad thing about DES is that not only do we have children with very severe reproductive and other sorts of issues, their children are having problems as well.
Oh.
Even though the parents didn't take it. So it was taken by the grandmother. So we're seeing DES grandchildren that are, so the drugs will pass down from one generation to another. So, I mention these things partly because I'm interested in them, but it's just not a lot of people know about this. And I think it's important to have a bit of an understanding of medical history of some of the things that have happened, and to question, what kind of care we're receiving.
Okay,
So
that's
as we
excellent.
go to the next slide, there's again just a lot of stuff that happens even today. A lot of this stuff is being done as we speak. I think the statistic is every minute 300 women are in labor at any point on the planet.
Oh my God.
Yeah. So right now 300 babies are being born somewhere around the world.
Yes.
And a lot of this stuff is still being practiced, and it's bad.
Unfortunate, Shawn. Yeah.
Yeah. So as we go on to the next one,
Yeah.
let's just see. Yeah, and then it seems interesting to me that it's just standard practice that when somebody's in labor, in my community anyway, in North America, that especially once she's in the birth room in the hospital setting, they basically forbid any food or fluid. And sometimes birth can be 24, 48 hours. And it's like, that's bizarre, that you don't get a chance to eat or drink. And again, not based on any research. And in fact, the research is so old, it's almost 100 years old now. And restricting food and fluid to somebody in labor actually causes problems in the birth. But it's still, we get into ways of doing things, and it's hard for us to give up our old habits.
Oh.
Instrumental birth refers to forceps and vacuum, cesarean surgery, very high rates, and not showing any benefits to mothers and babies past something like 15% of cesarean births. So we're looking at 30, 35%. Some parts of the world, they've got 50% cesarean birth. And there's some research showing that there are long-term negative effects to the baby. So babies who are born by cesarean can have long-term health problems just because of that. So it's just this idea that, cesarean is somehow better for the baby. That's actually showing to not be the case. And in my mother's day, all women, when they would go to the hospital, would be given a routine enema, IV, and pubic shave. Most of that's fallen away by now. And a lot of these kinds of practices aren't necessarily done with midwives. So depends on the setting, depends on the practitioner. When I worked as a midwife, I didn't, restrict food or fluid, any of that kind of stuff. So, yeah. And the Lancet, which is a medical journal, did a series on midwifery, and they found that if there was global support for midwifery, it would significantly reduce maternal mortality, newborn and infant mortality by 85%. I mean, that's shocking. And
Yes.
and why that hasn't happened is, anybody's guess. And we know from recent research out of the US, Canada doesn't track birth stats based on race other than Indigenous Canadians. So we do have some statistics on Indigenous Canadians. The statistics for them are really bad compared to non-Indigenous Canadians, in part because of a widespread poverty, living on in places that are called reserves, where they have very poor water, very poor heating, all of that kind of stuff. Poor prenatal care, poor nutrition. A lot of the communities can be quite remote, and so getting fresh fruit and vegetables into, say, the far north is hugely expensive, and so they end up with a lot of cheaper food that's simple carbs. But Black Americans, the maternal mortality 4 to 7 times higher, depending on where they are in the United States. And that's not because of economics. So this is also including middle class and upper class Americans. So they're getting very good care. They're well educated, well nourished, but why the maternal mortality rate is so high needs further investigation. A lot of people would say that systemic racism would be a really important part of all of that. Yeah, anyway, I wanted to kind of share some of these pieces because I thought
Yes,
they were
yes.
important. So in terms of, like you're asking earlier, how it can help women in birth.
Yes.
Yeah. Did you have any specific questions?
Yeah, like, what is the role of hypnosis in the delivery process? How does women get benefited with this?
So, with regular hypnosis, how would somebody benefit?
Yes. So,
Yeah. So there, I could spend a few hours talking about this, but generally speaking, if somebody's coming to me, usually they're mid-pregnancy. So pregnancy generally lasts 40 weeks if you add in the 2 weeks from conception to, from last menstrual period to conception. So if we're looking at 40 weeks as our kind of window, halfway point's around 20 weeks. I tend to get people coming after that point. And so you can do hypnosis one-on-one with somebody, and that can work extremely well, or you can do group settings. So generally speaking, in pregnancy, we're familiar with the idea of prenatal classes. And so having a small group setting where you teach everybody self-hypnosis, how to get themselves into trance, how to take themselves deeper, how to get the images and the ideas working for them that they like. So pretty common in hypnosis to say to your client, okay, relax, go deeper and deeper. And now imagine you're on a beautiful beach and the warm sun and the, beautiful sand. But not everybody likes a beach. Some people might prefer to be in a forest or stroking their cat, or I had one gal, her special place was, because we did the session and then we go around. So how was that for you? What worked, what didn't? And she said, my special, and everybody's telling, saying what their special place is, this beautiful nature setting, etc. And she said, when I went to my special place, she said, I was shopping.
oh,
And everybody in the room turned and looked at her, and she felt a little sheepish. And she said, but in my defense, she said, I was in Venice and I was going in and out of antique stores, and there was lots of beauty and lots of art. And so for her, lying on a beach would be incredibly boring and it would just drive her batty. But if she had something that in her mind that she could, would be interesting to look at and different and change it up. So the value of learning self-hypnosis is that then that can be used in the birth. So a lot of people know that in childbirth we have contractions. In general, do you, like, I don't know how familiar you are with childbirth. Do you know anything about
childbirth and role of hypnosis? No, Shawn, not.
Okay. So when somebody's having a baby, she'll have contractions. In general, the contractions last a minute.
Okay.
Sometimes they can be a little shorter, sometimes a little longer. But say somebody was in labor for 24 hours, right? So for first baby, it can be a good 38 hours that labor happens. And usually the longest part is the mildest part. So usually we're looking at, say, 24 hours of very mild, far apart contractions. So usually then they're about every 5 minutes. So what that means then is you have a contraction for a minute, and then you have a rest period for 4 minutes. Yeah. Then when things speed up, they'll often be about every 3 minutes. So you have a contraction for a minute and a rest period for 2 minutes. Yeah. So then what's interesting, and usually in birth when something's painful or uncomfortable is in the contraction. So
Okay.
in the rest period, as long as the baby's in a good position, it doesn't hurt at all, like nothing. So then you can use self-hypnosis in some interesting ways where, so say you're in the rest period and it's starting to build for the contraction, you can take yourself into hypnosis with your self-hypnosis, be in self-hypnosis for the contraction. And if you wanted to, you could take yourself out for the
Oh,
rest period,
okay.
which is pretty cool, right?
Yeah.
So it's just a lot of people kind of freak out and they think, oh, 12 hours or 20 hours or however long labor is. They think that that's somebody's in pain for that entire time.
Hmm.
No, 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 no. A minute. And then you just sit around waiting for the next one. So teaching people some of these ideas and then how to use the hypnosis in that structure. Like, so if say I was getting some invasive dental work, then that would be different. I'd use the hypnosis differently
Yes.
because I might be able to tell the dentist to back off. Okay, give me a minute, I'll take myself deeper. But I know that probably for whatever the length of time is, it's going to be, whatever. So I want to take myself deep. I want to numb that area. And I want to go really, really, really far away in my mind, right? And not even know that I'm in a dental chair, which, is totally possible. And all of those are strategies that can help with coping with that procedure. With childbirth, then somebody could maybe go to their happy place in the contraction and then do something different in the rest period. So you can kind of play with the different things.
Okay. That's amazing, Shawn.
It is
How
amazing.
many women can get benefited with this type of research and all these concepts? Yes.
Like how many people can benefit from that?
Yeah. Yes. Like once these concepts are educated to pregnant women, they can immensely get benefited with this knowledge.
I would say 100% of people would benefit.
Yes. Yes.
It's a no-brainer because it's safe. The drugs, assuming that you're having a natural birth, you're getting drugs in a natural birth. You're getting the drugs your body makes. Right?
Yes.
So it's safe for you, safe for your baby. So there's a couple of side effects that could be a potential issue with hypnosis, but as long as the hypnotist knows what those are, they're really easy to work around that. So really just that capacity to be able to go inward, to give yourself positive feedback, to tell your body to make all the anesthetic you'll ever need. It's just a lot of people just don't know it's possible. So once they start to figure this out, there was some research done in 1960 that was published, American research. And what they did is, I think they just found a medical resident or something like that. And they sent this guy into the room where women were in labor. And this is back in the day where they wouldn't let men in the hospital. So the women would be alone. She wouldn't have anybody else. She'd be all alone in this room in a hospital, probably scared out of her mind. And so they would send this guy in and who was trained in a little bit of hypnosis. And he would say, so if you're interested, I can help you out here. And really, like, who's going to say no, right? It was like, yeah, like, help me out. I really need some help. And so they had zero practice in pregnancy, but he just hypnotized them right then and there, and they had great outcome. It was fantastic. So it can be done in the birth room. It just works better if she's had as much of the pregnancy as she can to practice and to get used to it and what she likes and what works for her. So.
Good.
Yeah.
And Shawn, I've seen many gynecologists refer people to visit hypnotherapists. So what's the
Right.
reason behind it? Shawn.
Yeah, okay. Before we get to that one, there's a couple of other slides
Okay.
that, yeah, I just wanted to show this one. I think it's just this one. There's a fair bit of research, and the whole topic of the use of hypnosis for birth preparation is fairly complex. Like I could spend a couple of hours talking about all the different research, but I just pulled a couple of pieces here that, for the most part, will show significant benefits. The faster hospital stay, reduced complications, reduced medication use, pretty much across the board. There were 3 large trials that came out in the last, say, 5 or so years, and they were, from my perspective, and I'm sure the people who did the research, they were disappointed as well, that it didn't have the kind of effect that they wanted. And what happened was they did things like they said, okay, we're going to do 3 one-hour sessions. One study did 2 one-hour sessions. And it sort of helped, but not really. Certainly not in the way that we know hypnosis can be really helpful. So one of the things that I would say is if you're looking at the research and you think, oh, well, it didn't really seem to show a lot of benefit, I think it's because of the way the study was set up. It was set up with doing only a little bit of hypnosis very late in pregnancy. And for the most part, today, that's not enough. People need more. So get started early, get your practice underway, get familiar with doing your hypnosis a lot. And for any hypnotists listening to this, you can set your clients up with, like, do a number of sessions, teach them what they need to know, and then she can continue doing that work. Like, hypnotists don't have to go to the birth. You can just do the sessions with them. I'm working online, so you can work online as well. Like it's pretty simple and easy that way.
That is
Yeah, so to just know that it's hugely helpful. And then I think the next slide, if I remember correctly, yeah. So this was quite a while ago when I looked at my stats and for my clients. These were all for first-time moms. So if you're not familiar with birth, first-time births tend to be longer, more difficult, more complications. Second and subsequent births tend to be faster. So my clients averaging an 18% epidural rate, which is quite a bit lower for our culture. There's hospitals in Toronto that have like 95%. It's extremely high. And one of the things that people don't really know about epidurals is that the in the epidural are fentanyl, which is a fairly potent narcotic, and usually it's mixed with an added cocaine-based drug because they potentiate each other. What a lot of people don't know is that those drugs pass the placenta to the baby. So the baby will get the fentanyl in the system as well. So it's safe in the sense that it can cause fetal distress, absolutely, which then results in higher cesarean section rates and so on. But this idea that the only way that I can get pain relief in labor is with these drugs that they're providing for me is not true. Because really the biggest pharmacy on the planet is the one between your ears. Like, you make better fentanyl than the pharmaceutical companies do. And it's good for you, good for your baby. Cesarean section rates drop, length of active labor. So a drop from 12 hours to 4.5 hours is huge. So it's just that to know that, and the length of pushing as well. So that reducing the amount of time you're dealing with it, reducing the intensity makes it more manageable. Now, no hypnotist can promise 100% pain relief to everyone, right? Because hypnosis is variable. Even an anesthetist can't promise 100% pain relief, right? But what we can promise is that you have the capacity in your mind to be able to make this much more manageable, be able to get through it. You may not like it, like some labors are really, really painful, like, you know, I grant you. Some are just like I asked to be sent to a hypnotist when I was pregnant with my first, and my doctor sent me to a psychiatrist because those were the only people back then who were doing hypnosis. So I did a bunch of sessions with a psychiatrist, and I didn't learn self-hypnosis. So when the birth started, I didn't do anything consciously. My unconscious mind did it all. And so I had this pretty fast birth. And throughout all of it, one contraction hurt. And it was kind of funny because I was like kind of coasting all the way through and going, oh, this is interesting. And I was a midwife at the time too, right? And then I got this whopper of a contraction. It really hurt. And I was so upset. I was like, that's so unfair. That one really hurt. And then, you know, my baby was born not long after. So even though I would call that a painless birth, it technically was one contraction, but it was like, you know, how cool is that, right? That went the way it did. So yeah, that's kind of, you know, a little bit of data on the birth. And sorry, you had a question about...
Yes. My question is, Shawn, like, I know a lot of gynecologists, they refer their patients to hypnotists. So you kind of gave a good overview on why do they do that. And would you like to add something more, Shawn?
Yeah, I think so. Generally speaking, gynecologists and obstetricians, like physicians who specialize in female care, are called, in our culture, they're called OBGYNs, so obstetrician and gynecologist. It's not uncommon in some cultures for the OBGYN to be the primary practice doctor for a woman. So the idea is that because the OBGYN specialists in female care, then they just go to that doctor for all their care. I don't find people here tend to do that. In my setting in Ontario, we have family practice doctors that we do. And then if there's a specialized problem, we'll go to an OBGYN. Now, specialists will refer their patients for any number of different reasons, but generally pain, anxiety, medication, surgery that has been tried no longer working. So the kinds of things that, say, a gynecologist might find helpful. Any kind of nausea. So nausea and vomiting in pregnancy responds really well to hypnosis, and nausea for chemo, for cancer treatments, can work really well with hypnosis. Any kind of fear of needles, white coat, hypertension. I think maybe I've got a couple of slides on this if you want to.
Okay. Let's see benefits of hypnosis and
There we go.
And gynecology.
So lots of different, and you know, pelvic pain is actually quite an issue. People who, whether now things like endometriosis and other kinds of conditions are extremely painful, but then there's other types of pelvic pain where it's just like everything's, I don't know, just really tight. There's just not, it just really benefits from relaxation. And, but it takes a bit of work, because if somebody's in a lot of pain in a particular part of the body, it's probably been that they've been like that for quite some time. So they're usually not going to benefit from just one session. Usually they'll need a bit of work, and they'll need to be practicing with relaxing the area. There's quite a bit of research in the field of hot flashes for women who are menopausal. and IBS and gut issues. Quite a lot of growing body of research in hypnosis that's showing huge benefits. Of course, anxiety, post-traumatic stress disorder, all of those. A breech presentation is when a baby in pregnancy is bum first or feet first. So normally in the last months of pregnancy, babies will go head down. So head first is the most important, is the best and easiest way for a baby to be born. So if a baby is breech, it's interesting, you can do hypnosis, hypnotize the mom, and then the baby will go head down, which is pretty cool. So Dr. Luis Malmadrona did some research quite a while ago, and he found 70% of the people he hypnotized, that babies went head down.
Wow.
And it's completely safe, right?
Yes.
It's
That's
fascinating because the
amazing.
baby's listening.
Yes.
The baby's, oh, I need to go head down. Oh, okay. Then they go head down. It's so cool.
Wow. This is amazing, Shawn.
Yeah.
Getting to know so many things. So that's the beauty of this interview series. Get to know, like, from the experts in this short period of time. I get to know so many things, and hope the audience is also getting benefited. Now, my next question is,
I have,
yeah,
so,
it's Shawn.
so just in terms of the pain, I did a couple of studies. And so if you go to the next slide,
Yeah.
yes. So this is a study by Montgomery that was a meta-analysis. So that's very good research. And if, like if a medication that was not addictive and didn't have problematic side effects, had a 75% pain relief, that would be considered pretty good. So hypnosis is getting some good credibility in terms of being effective. And cancer pain and burn pain are like really intense kinds of pain. And so using hypnosis in those areas, because a lot of times people be given narcotics, and what we know about narcotics is people need to keep upping their dose because it just stops sort of working at the dose they were at. And it's not you can't be, it's just not safe to be on that for the rest of your life. So hypnosis is safe, and it's a way to create comfort in the body that is just easy to do, and people can do it themselves. So that's Montgomery. Next slide is, and again, this is just a sampling of some different pieces of research. This is a study that was published that looked at 13 trials that were done, bone marrow, aspirations, lumbar punctures. Like these are all really, really painful procedures. And there's a psychologist in the West Coast in Canada who used hypnosis in children, having spinal taps being done on them. So 3-year-olds, and just sitting perfectly still, reading a pop-up book, and no local anesthetic, no anything. And so they just use their imagination and they stay still, and it's over and done with. So pretty amazing.
Yes.
And then let me just see another slide. So just pain relief across the board, loads of research. So the other thing is too, you get the benefits of feeling better. So better sleep, feeling, better with life, feeling better about yourself. The treatment's working better. I had one client who came to me because she was going to be having surgery. I can't remember. I think it might have been for uterine fibroids. And so when we were talking in the session before we did the hypnosis, she said, my doctor said to me, usually there's a lot of blood loss with this surgery because of just, the nature of it. And so we kind of talked about what are your goals for this surgery? What do you want? She said, well, I don't want to lose all that blood, right? I want to be able to get to the surgery. Okay. I said, okay. So we hypnotized her, all good. So she said the day after, I think it was the surgery, her surgeon came in just to see how she's doing, check up on her and so on. And they were chatting about the surgery. The surgeon said, yeah, it went really well. It's just, perfect, classic textbook surgery. And she said, and there was very little blood loss.
Oh,
Yeah,
wow.
yeah. And
Amazing.
my client looked at her and said, well, that's because I did hypnosis with Shawn. The surgeon was like, what? Had no idea what that meant, but it was important to her, right? That, oh yeah, we did the hypnosis and it worked, right? It made a difference. Yeah.
Wow.
Yeah. So I think that's, again, there's loads on the topic of pain research and what can be done with hypnosis, but I think that's the last of my slides for that.
Mhm. So you want me to move to the next?
Yeah.
Okay.
I can't remember what it is. Oh yeah, okay. This is all the fertility stuff. So
Yeah,
this
this is where my question was like, what is the role of hypnosis and how does it help people with the fertility issues, Shawn? Yeah.
right. So again, I think I would say good hypnosis is hypnosis that identifies what the needs of the client are. If you take a cookie cutter approach and say to 100 of your clients with a particular presenting issue, I'm just going to use this study. It's quite possible it could work, but you want to adapt based on the client. So some clients come to me and maybe they're on IVF number 4 and they're going to be going for a retrieval. She doesn't have zero fear of needles. She's been through it before. She knows what's happening. So she's not frightened, but she just wants good outcome. So we focus on that. I have other clients who are like, I faint at the sight of needles. I had one gal who was so frightened of needles. So I said, sure, yeah, come on in, we'll do some hypnosis. We'll clear that up. We'll get rid of that fear. That's not a problem. And she said, but my doctor said, you have to be there, Shawn. I said, I don't have to be there. Then we just hypnotize you. You're fine. She said, no. He wants you there. Okay, fine. So I go. So this was a fertility. They were doing egg retrieval, which can be painful. So she had a bit of sedation, but she's not going to let anyone do sedation because of her fear of needles. So I had to hypnotize her and get her into a place where she was fine with it. It went beautifully. It went really, really well. But and another client who was getting an epidural for childbirth, and usually anesthetists don't let anybody in the room when they're administering an epidural in labor. They let the partner in and anybody else who might be there after everything's taken place. And it was funny because so we're in the little birth room that she had, and the anesthetist, young guy, comes in and he's got a mask and he's got these big eyes and he's like and she's sort of explaining to him that she literally freaks out at the sight of needle. Like I go insane kind of thing that she's telling him. And his eyes are getting bigger and bigger. It's like he's looking really scared. And then she looks at me. I happen to be there. And she said, and she can calm me down. And so the anesthetist said, yes, she can come in the room. Absolutely, she can be with you. So what I'm finding and what we see in the research is that stress is not good when you're trying to get pregnant. It can actually interfere with things going well. It doesn't mean that if somebody's having problems getting pregnant, it's because of stress, right? Could be any number of different reasons, but we just don't want stress to add to that. So reducing stress is huge. Reducing fears is huge. Building a success mindset, because a lot of them, especially if they're going for more than one procedure, they're in and out of the clinics, they're starting to worry, they're doing internet searches on what does FSH mean and AMH and what are my levels, and oh my goodness, now I'm 20 something and I'm close to menopause. Like it can freak you out really easily, right? It doesn't take much. So a lot of times I need to de-hypnotize them, right? Because sometimes the doctors are not being mean, but they'll say to them, oh yeah, you're really old, right?
Yeah.
36 or something. And you only have a 5% chance of ever getting pregnant with your eggs. And it's like, it's devastating. It's like, okay, do you want to be hypnotized by that? Or do you want to be hypnotized with, of course you can have your babies, right? And it does, like we see people going through procedures and then we can add some hypnosis. Sometimes they get pregnant naturally, depending on their medical status. But it can really make a big difference with adding some hypnosis where they might have a bit more confidence. Confidence is helpful. It's not essential, but it's helpful. Less stress, and just telling the unconscious mind that it's safe. It's safe to get pregnant, right? And to have these babies. Sometimes working with grief and clearing up old trauma, really important, because if you think about it, the unconscious mind is there to protect us, keep us safe. So if somebody's had a very painful experience, like really wanted to be pregnant, got pregnant, then miscarried, that would be hugely painful. For some people, not everyone, but for some people, the unconscious will then say, oh, that was really painful. Well, I'm just going to fix it so it never happens again. So then what you see is you see somebody who gets pregnant, miscarries, and then just can't even get pregnant, right? When normally she can get pregnant, but it's just something seems to be stopping. Well, sometimes that's the unconscious mind just saying, okay, we're not even letting a pregnancy happen because that might lead to miscarriage, which would be too much pain, which makes sense to the unconscious mind, but that's not what we want. So we have to turn that around. So there's a bunch of different things. Sometimes I had one client who came to me first session and she said she was starting for the first time with injectable drugs. And they'd done IUIs and some other procedures previously, but this is more, we're just getting into more heavy duty stuff with the IVF. And I said, okay, sounds good. And she said, but these drugs will kill me. I said, what? I said, who's your doctor? And so she gives me the doctor's name, very respected doctor, very good clinic. I said, this doctor would not give you drugs that will kill you. I said, where'd you get this idea? Oh, she probably found someplace on the internet. Okay. So I need to dehypnotize her, right? And because if she's going to be injecting herself with a needle and saying, oh, this is going to kill me, like, that's not good, right? You want to inject yourself and go, oh, I'm going to be so fertile. I'm going to make all these amazing eggs. It's just going to be so perfect. My pregnancy will go to term. So that's what you want her telling herself, right? So depends on the client. Depends on what their needs are. So
you have such a rich experience, Shawn, and listening to your case studies has also been very inspiring.
it is, isn't it? Yeah.
Yes.
Yeah. So I just interesting that the research from Alice Domar showing that the stress of infertility is equivalent to people who have cancer.
Oh my God.
Which is like really, yeah. So again, if you've never known anybody who's dealing with fertility issues, we kind of know it's kind of not good. But when we realize that the stress levels are that high, it really, and I don't want to say the obvious here, but it's just sometimes people will say things like, oh, well, you just need to relax. And then you'll like just go on a holiday and then, have a baby. It's not helpful. Because, I think if anybody would have thought of that, it would have been them, right? Like, this is not a new idea to them. So to just, if you know somebody who's going through fertility issues, to just be just be compassionate, just listen, just, don't try to give advice, just kind of be there for them and just know that they're going through a lot. It's really painful. And, hopefully it'll all work out and everything will be fine. Yeah. So there's a bit more research on the next slide.
Yes, there we go.
Yeah. So again, we're seeing research showing that hypnosis is helpful with reducing anxiety, helpful with embryo transfer, and as effective as diazepam, which is, makes you kind of relaxed and calm and easygoing. But there's no side effects. There's no problems with the hypnosis. The research in 1997, the third part of the slide, that IVF ET. So ET is embryo transfer. So IVF is they get the egg and then they have it turned into an embryo. They assess it, and then they'll put one or more embryos back based on a number of different factors. And then there's another slide. There's loads of research in this particular arena here. So the next slide. There we go. Yeah.
Yes.
Reducing, sometimes people get very anxious prior to surgery. So reducing perioperative anxiety and pain. It also reduces medication, and medication drops with the use of hypnosis can be measured. So that's one of the hard pieces of data, that if they're offering people hypnosis for pre and post operative, they can count how much medication somebody's actually had. And then the last two slides are from Israel. So Israel, I heard, will fund as many IVF cycles as needed for 2 babies. And so it can be quite costly to do this. And I mean, not uncommon for one cycle, like a month of IVF, to be $10,000. So if you go back to that previous slide.
Okay.
So this was interesting because he found about double the rate of implantation with hypnosis. And all they did was they did 15 minutes of hypnosis before the transfer, and I think 15 minutes after, something like that. So very short. And that's based on, sometimes people will do acupuncture. So they'll do a 15-minute acupuncture session before and after the embryo transfer, and double the rate of pregnancy, or almost double the rate of pregnancy.
Wow.
So big difference that way. We don't see this research in North America because people pay for, the governments are not really paying for it. So in Ontario, the government's paying for some stuff now. In Quebec, they pay for a bit more, but in general, a lot of people are still paying quite a lot of money out of pocket. Okay. So those are the kinds of things that it can help a woman with. I didn't do any slides for what hypnosis can help a man with, but we know that stress will reduce sperm production, reduce the quality of the sperm. Sometimes sperm can have this thing called DNA fragmentation. Mm-hmm. So there's a procedure called ICSI where they take the sperm and they inject it into the egg. So the sperm it's not, for whatever reason, the sperm can't fertilize the egg. So they're actually literally just putting the sperm inside the egg. So if we get the sperm stronger and we get his hormone levels doing better, the testosterone, and then socially, sometimes you can get a lot of issues in a relationship with couples where they're just really stressful. And then making a baby becomes anything but romantic. It's like, okay, we're ovulating tonight. And the poor guy is like, oh no, right? After a while, I was like, okay, we need you to, you know. So, I mean, the biggest erotic organ in the body is the one between the ears. So that's what we use for helping with our sexuality. So if we're not kind of in that right place, then hypnosis can help with that, definitely. And so, this is just, so if somebody's a hypnotist and thinking, yeah, I've got a client, what do I do? Or if, say, a client comes to me and, whatever. So I think at the very least, you can do a lot of good by just helping reduce stress. Even if you don't have any training in this field, even if you know nothing about fertility procedures, just be compassionate, help them reduce the stress, help them with having a better identity, right? So a lot of women and men will kind of go, oh, I'm a failure as a person because, I can't get pregnant or make a baby. And that's not true in any way, shape, or form, but just helping them see themselves as, really good people, and they're struggling with an issue. But the issue doesn't mean I'm a bad person or anything like that. Helping them with their relationships, helping with mood, because somebody who's depressed and anxious, we know from the research that's going to impact fertility. So if we can help with that, that's going to make a big difference as well. So
a new perspective to me as well.
yeah. Now, I did have a client who had done some fertility procedures and then came to me after she'd done those procedures. So they'd done IVF, done the transfers, didn't get pregnant. So she started the hypnosis after that. So she was going into a new procedure. And so that last point where I'm just saying, be careful, especially as a hypnotist. So as we're talking about it, she said, okay, they're going to be putting 2 embryos back. And previously they'd only done 1 embryo. And I said, oh, are you okay with twins? And she said, well, it's not going to happen. She says, I'm not fertile. I don't get pregnant. It's just never going to. I said, you might want to be careful about this. I would really talk to your doctor. Anyway, long story short, she got pregnant with twins. So to just realize that if you're introducing, now the majority of people are thrilled with having twins because they just figure, okay, great, we don't have to do any more of this. But just to know that if you're introducing a new piece in all of this, it could be quite effective. So not to assume that it would only be minimally effective. That like in Canada, the restrictions are pretty tight. They wouldn't let somebody put, I don't know, 4 embryos back or something like that. Like they can assess the quality of the embryos. So if they're just really, really, really poor quality, then it's not that big a deal. But in some cases, what we've heard about of people having like big multiple pregnancies, like 4 or 5, that kind of stuff. It's not safe for her, not safe for the babies. So it's just best to, but then the other thing is you can talk to the unconscious mind and ask the unconscious to work with whatever it is that's happening in that, all of that. So, yeah.
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 And that brings just a couple of questions I have, Shawn. Just I know the last few questions is like, do hypnotherapists get special sort of training so that they can help people with these kind of issues?
Right. So it depends on where you are. Like there are some places in the world where, like prior to 1997 in Ontario, you had to be an MD or a dentist in order to do hypnosis. And then the law changed. So I'm not an MD, I'm not a dentist, and I can do hypnosis. So it depends on where you're practicing in the world, depends on what the rules or regulations are. But in general, I think if this is an area of interest, then I think like anything, like if you're interested in doing hypnosis for golf, you would want to learn all about golf, and you're probably already a golfer, and et cetera. So there's some training out there. Absolutely. I did the training in HypnoFertility many years ago. A lot of my additional training has just been with my clients. And so it's not difficult work in the sense of figuring out kind of what to do. It can be difficult emotionally. It can be really hard when somebody's gone through a lot and then, doesn't get pregnant or miscarries or something. It's like you have to be with them through that. So as the hypnotist, it requires having an emotional intelligence that can help you be with your client in that regard, to provide that support. And not everybody's interested in that, but if somebody is, it's really needed. I mean, the stats just keep going. They said 1 in 6 couples will have problems getting pregnant, and it just keeps going up. And then of course, couples who are same-sex couples, a little bit difficult to get pregnant naturally. So, they're needing to go through fertility procedures in some way, shape, or form in order to have a baby. Yeah. And it's I don't know, it's a bit of a head scratcher why fertility is such an issue these days, but it's a big problem. Yeah.
Got it. And Shawn, you have created Childbirth Prenatal Hypnosis series.
Yeah.
In 1999. So could you please tell more about what exactly is that?
Well, I started teaching prenatal classes a long time ago, about 35 years ago or so. And they were just standard prenatal classes. So when people think about prenatal classes, they think about Lamaze classes. I don't know if that's a term that's familiar to you and your part of the world. Lamaze was a French physician, and so in the 1950s, he actually studied the hypnotists in Russia, and he created his own kind of version, which has some hypnosis aspects to it. So it's pretty standard if somebody's expecting to have a baby, that part of what they do to prepare for birth is to go to prenatal classes. So I've been doing that for a long time. And let me just think of the timing on this. I had my first using hypnosis and quite liked it. Went really, really well. And I always thought it would be really neat to do hypnosis and combine that with prenatal classes. And when the law changed in 1997 in Ontario, I thought, great, sign me up. So I did the basic training in hypnosis so that I could work with pregnant couples. And so I just created, my own version of this work, just to create a combination of information for couples so that they have, remember when I was talking earlier about the contractions and, a minute and the rest of it. So I think, it's one thing to say to somebody, oh, you should just, go into trance and be relaxed and think positive things in the birth. And that can work quite beautifully, but we can make it even better than that. We can make it more effective. So, yeah.
And my last question for this interview, Shawn, please tell me about your bearing witness, Childbirth Stories Told by Dollar series, about your book.
Oh, okay. That was not my book per se. It's I was invited to submit a piece and it was accepted and the book was published. So doulas are they're not healthcare providers in the sense of they don't have hospital privileges or work formally within the healthcare system. So in our culture, a doula is somebody who provides additional support either in the birth or after the birth.
Okay.
So often, if it's after the birth, they'll come into the home and they'll make meals and they'll help with whatever's needed in that regard. And so this is a book written by doulas, and that I was a doula for a while as well, and just kind of our perspectives on birth. And so yeah, it was really nice to be able to be part of that collaboration.
Yes, because a lot of people will get benefited with this stuff as well. It's been a wonderful conversation with you, Shawn, and it was like a mini session itself on benefits of hypnosis, and with all the research. I appreciate the time that you have taken for collecting all that information. Thank you very much. I know it's late already for you. So thank you once again, Shawn. It's been wonderful talking
Yeah.
with you.
Thank you very much for inviting me. I really appreciate it.
Thank you.
Good. Okay.